everyone. It's a pleasure to be here this morning. I hope you've woken up and feel energized. My name is Ringler. I'm a member of the global leadership group of Ashoka. Ashoka is the world's largest network for social entrepreneurs, people whose entrepreneurial mindset shifts, disrupts markets and the way we think about social change. And I lead our work across Europe. In total, we have around 3,600 of those social entrepreneurs in our network in 92 countries. And one of the key things of the work that we do is we try to understand how systems are changing. 3,600 people who are driving social change in any given topic help us understand the patterns and trends in this world. And I want to share just a few thoughts with you. You're seeing this slide behind me. This is one simplified way of thinking about the levers that change ecosystems and systems more generally. And the reason I wanted to share this with you is because in this session we're going to dive deeper into the question of what are the key levers? What are the drivers? What are the incentive structures? What are the role changes? What are the power changes that drive ecosystems and change within systems? And as I said, this is a simplified way of thinking about this. But why is this relevant? Because in a complex and interconnected world, we all know that with all of that, the question of who's in charge is in question. We've heard quite a bit about that yesterday. We also need to rethink where capital is coming from and how it's being pooled. We need to rethink how talent is attracted, how resources in general are attracted. And we need to rethink the way we measure success. And the three people that I'm welcoming on stage for this session today are people who really, truly rethink success from a very radical standpoint. There are three amazing practitioners, people who are in the midst of making things happen. And I'm very, very pleased to welcome on stage Jos de Blok, Kevin Hrusovsky, and Caroline Kant. There are names here. Look, there's your name, Kevin and Caroline. Yes. We're going to start this conversation with an input from Jos de Blok. Jos' organization has been voted the best and most favorited employer 5 times in a row. And you may think that, who cares? But the point is that the work that Jos does is in a sector that's traditionally a place that people want to leave, that doesn't feel like a good workplace. It is in elderly care. It is in supporting people who are sick and ill at home. And the work that Jos has created over the last 12 years is really, truly phenomenal and revolutionary. He started Buurtzorg 12 years ago, and he now has 15,000 employees across the Netherlands. And how he did it is something he's going to share with us for 5 minutes now. Jos, do you want to go to the...
Yeah. Thank you. Yes, good morning. I push the button. Okay, it's already happening. Let's see. There's another one here. Yes, I started with Buurtzorg in 2007 because I was not happy with the way healthcare was organized in Holland. I'm a nurse myself. I worked 15 years as a nurse, as a community health nurse. And after that, I worked 10 years as a director. And I changed the idea that community care, home care in Holland was delivered by building on these principles. These 6 principles are the cornerstones of our organization. We said we should integrate social and health care. We should focus on relationships. We should focus on outcome. We had a system where we focused on products and minutes and all kind of codes, and it led to a lot of bureaucracy. And we said the process of helping people is not so complicated if you can focus on the problem and the results of the problem. So we changed that. We also said there is a lot of bureaucracy in the system. So let's the nurses do what they're good at, taking care for patients, and let's build an IT company to take care for the software to deal with the bureaucracy. So we also started an IT company. We said the nurses should be happy with the way they're doing their work, and the software should be supportive instead of a bureaucratic obstacle. And then we said we have to go to the scale of a neighborhood. In a neighborhood, you know the networks, you know the culture, you know the resources. You can see the neighborhood as an ecosystem. So we said if nurses, groups of nurses are working in neighborhoods, they can build their networks with doctors, with volunteers, with everybody who can contribute to the solution for patients. We built on a simple idea based on my experiences I had as a community nurse in the 80s. We said, let's create small teams with a maximum of 10, 12 people. I always said as a joke, we don't find bigger tables at the IKEA. So every team finds an office in the neighborhood they're working. They organize everything themselves, so they do the assessment with patients, they connect with doctors, they hire their own colleagues, they schedule their own programs, and they register what they're doing in the IT system we made. The teams are responsible for everything, so for the quality, productivity, and also for the collaboration. These are the 3 guidelines. So the moment they started, we said, let's forget all the protocols and codes you learned in the organization you came from, and just do what you think based on your professional ethics, what you want to do. And this is what happened. After the first team, where I also started to work as a nurse again, we got a lot of attention from out of the whole country. We got a lot of publicity, even support from the Dutch ministry. The Dutch ministry said, okay, this is a good thing. So at the moment, we have almost 1,000 teams all over the country working, self-organized, without management, without leaders, and doing very well. We have almost 11,000 nurses, and all these nurses every day are just doing what they think they should do. We don't make policy plans. We don't build every time again a strategy. We have one strategy, and it's helping people in the best possible way. I write my blogs once in a while, and then we discuss the points which need to be discussed. This is the turnover growth. This year it will be €500 million. I started with €400 in 2006, and it's 500 million now, but it's still on one sheet. We have a very simple business model. So I said, as long as we have more income than costs, we are doing well. So that's our financial strategy. And I said, that's just like home. If you spend more than you have, then you will have problems in a while. So it's, I made this, before I became a nurse, I studied economics 2 years. So I quit my study, but that's the reason that I made a simple business model. We don't have a CFO. That's part of my work, 2 hours a week. It's the most easy part. So if you have a CFO in your company, you know where the problems come from. Sorry, it's not personal. We have, this is our structure. So we have 15,000 employees. Besides the 11,000 nurses, we have 4,000 care workers. And we have 50 people at the back office. So we said we are only going to do at the back office what the nurses need to do their daily work. We have 21 coaches. The coaches are supporting the teams. And we have 2 directors, and I'm one of them. We don't have a management team. We never had in those 12 years a management team meeting. We don't make minutes. We just do what we need to do, and that's taking care for patients. And when there is a problem, we sit together with the people who can solve the problem, and we solve the problem. That's it. If you look at the results, from the start we had the highest patient satisfaction. At the moment it's 9.3. And it's very stable throughout the years, all over the country. We have very satisfied nurses because they feel they are owner of their own work, so it should be strange if they're not satisfied. We became 5 times best employer. The overhead costs are very low. The average overhead costs are 25%, 25 to 30% in Holland. We have just 8%, so we can spend the money on higher educated nurses and on quality and innovation, and so on. We had 1,200 new colleagues per year without doing any marketing. We got the prize for the best marketing in healthcare, but I said we're not doing any marketing. It's the same with this best employee satisfaction. We don't have an HR department, so if you don't put effort in HR, you get the most satisfied employees. And then this is our model. Yes, thank you. This is our model. We say you can look at healthcare from different perspectives. And a lot of companies are trying to create production and try to produce. We say no, if we make ourselves not needed anymore, that's our ultimate goal. So if we can make people independent, they will be more confident, they will be happy, they will have a higher quality of life. So the focus is on creating networks around patients which are helping the patients to take care for themselves. And we are there when it's needed. So teams are very flexible and all the time evaluating what they're doing, rethinking what they're doing. These are the principles on self-organization. So we said we are going to build on trust. Why shouldn't we trust nurses? I don't know any nurse who says in the morning, today I'm going to do a terrible job. So nurses want to do the best possible thing. And if we avoid complexity, they can oversee what they're doing. So a lot of organizations create a lot of complexity. We said, okay, let's avoid complexity. They're generalists, they're high educated, they have their own education budget. And we said informal networks. Every nurse has an informal network. If you have 10 nurses, you have 10 informal networks. And it's more important than formal organizational structures. This is our strategy on the IT part. One of my friends was an IT specialist and was also a musician. And in 2005, together with a lot of beer and wine and nuts, we defined this strategy. And he composed a wonderful strategy which is very supportive for the nurses and the patients. At the moment, also patients are part of our community. They can communicate with the teams on the platform, also family members. So it's a network. If you look at the benefits, what we wanted to show in Holland was that if you perceive healthcare and if you deal with healthcare in a different way, that it can save a lot of money. So for the system, we showed that we reduced the hours of care with a high satisfaction with 40%. So there is high satisfaction with the patients, high satisfaction with the nurses, and less cost for the system. So it was for that reason that we got a lot of support from all the political parties. The right party said, oh, it's a very entrepreneurial model, and the left party said it's nice that it's built on solidarity, so everybody was happy. So this was, I think, one of the last slides. We do a lot of innovation. Innovation just starts everywhere. And the most nice innovation was the walker race. So you can see on the right, every year in the Olympic Stadium, we have a walker race. We have a competition of elderly people with walkers in every village. And then the best elderly can come to the Olympic Stadium in September. And then they have a competition on 400 meters, 800 meters, and so on. The eldest last year was 104. And this is just an idea of one of the nurses in Amsterdam who in 2010 had a question from one of the patients. He said, there are competitions for everybody, but not for us elderly behind walkers. So she said, why shouldn't we organize it? So now thousands of people in Holland are training behind the walker. And you know, it's another perspective. It doesn't cost any money. And it leads to networks for people, social networks around people. They feel they're not sitting behind the windows, but they're just doing a competition. Okay, I think I'm going to the last slide. Or not, I'm pushing the button. Yeah, so this is what happened in other countries. From 2009, we got a lot of attention from Japan, the US, and Sweden. And after that, it went through all of other countries. And we started partnerships with people in these other countries. And when we talked with nurses in all these countries, they had the same perception about what they should do. So we started small groups of nurses in these countries. We are building partnerships, and we think that at the moment we have 25 countries where we are working with partners and with nurses and doctors. And this is just what's happening by itself. We are not selling ourselves. Everybody comes to ask, can we work together? So, and this is what we try to do, and this is the way we want to have impact in healthcare. It's just a part of what we're doing. We also do mental care, we also do social care, youth care, maternity care. My idea was to build another infrastructure in the community so that the problems of patients are leading the infrastructure of the healthcare. This was what I wanted to share with you, and this is what you can see. Okay, keep it small, keep it simple, and everybody will be happy. Thank you.
Thank you very much, Jos. We'll have time to discuss and delve a little deeper into how simple things can be, or how hard sometimes. I want to introduce to you Kevin Hrusovsky. He is a biotech serial entrepreneur, somebody who has founded a number of companies and came back from retirement to build a company focused on precision health, Quanterix, that is tightly integrated into a system and has a market valuation of 700 million. So really showing that with an innovative approach and a base of trust, you can do anything. Kevin, your presentation.
Thank you, Maria. It's a real honor to be here. I'm Slovak by heritage. I'm told that my grandparents were born just down the road, so I'm looking forward to getting a little bit closer to this. It's a real privilege to be part of what I understood you to describe, Maria, at the beginning of this, and I think I would like to get a job working for you, Jos, because you're quite the shaker and mover, and I really appreciated your comments. Caroline and I both, I think, would like to work for you if we could.
Welcome.
Basically, the way we've tried to inspire a movement is being a catalyst. And today, medicine is practiced in a pretty interesting way, where most of medicine is you get symptoms from disease and then you're treated. We think that there's a revolutionary way that we can see in the body and look in the blood. There's 6 quarts of blood that traverse about 60,000 miles throughout your body every minute. That 6 quarts of blood is full of incredible information. And that information, we've created rocket science to look inside of it to see long before symptoms, disease. And most importantly, we think we can understand how we can evolve our own health journeys and the way we live our lives. We've learned over the last 25 years by the DNA movement that the identical twins are born with the exact DNA, but one twin will grow up to get cancer, while the other twin will grow up to get heart disease, even though they had the exact same DNA. And what we've learned is that 80% of disease is how you live your life, not what you're born with. And so we actually think that these biomarkers of looking inside the body ultimately can be put into a watch and to actually monitor your own health journey to understand if you're getting concussions by playing soccer or rugby, or if you're drinking a lot of alcohol or smoking or eating a lot of sugars or using a lot of the growth hormones in today's food supply and red meats, you're creating many of the cancers and many of the heart diseases. We think someday you're going to be able to monitor your biomarkers in your blood and to empower your own health journey. How do you take a simple concept of going from reactive treatment of disease to prevention of disease? when the whole world makes money by treating disease, that then says you need to have a movement. And there was a company called Theranos that actually created a lot of excitement around looking at blood, but it became bad blood because the investors felt it defrauded. So that we started with a concept that we have to make the investors part of the community for a long-term horizon of investment. Instead of looking at 1 quarter or 1 year on returns, look at a 10 to 20-year return so that companies can give back more to the world than they take from the world. It's very, very important to look for returns on a very long time horizon in order for companies to invest heavily to transform the concept of healthcare. So here are some companies you can see that have been increasing value very largely. Our company is increasing its value for investors not by creating profits, but by investing into the next generation of technologies, a very different concept. What we do is we look into the body with this exquisite technology to see these biomarkers so that when you do things with your body, we can understand long before symptoms. We can actually see Alzheimer's today based on a recent study from neurologists in Sweden, 16 years before dementia. And if you can see it that early, the drug companies then have a much better chance of putting out the disease because it's very early. It's like a match that can be blown out when the disease is that early. If you wait till you have dementia, it's like a raging forest fire. For the drug then to put out the raging forest fire, it's very difficult. So many of the drug companies now are using these technologies to get new treatments approved by looking at disease much earlier. We have a 5-step process that starts with greater purpose and trying to give more back to the world than we take. And then we build an ecosystem. We were in Barcelona for the last 2 days. We had all of the top neurologists and oncologists in the world presenting peer-reviewed publications around the way they're transforming science and medicine by looking in the body into the blood. And that's an ecosystem. As you see here, some of what we did there created a lot of excitement, and we had many of the patient advocates there from the Alzheimer groups. We had a lot of cancer patients. So we had a lot of people there inspiring this group of scientists to keep inventing and really to persevere looking inside the body into the blood to create these impressive opportunities for the future. So in summary, we are a company that is basically changing everything we do by starting with a greater purpose for the world, getting investors to work with us and be part of the ecosystem, and to use the patient advocacy groups to help us see how we can get to disease when it's still very treatable, extend life very productively, and then ultimately move into empowering every individual to look at their own body and to understand how they can prevent disease for them and their families so we don't have to go through premature pain and suffering. So we're very excited about how this turns into a movement as opposed to running a very small company. It turns into a major ecosystem movement that we think is important to be able to look at long-term returns.
Thank you, Kevin. And finally, last but certainly not least, I want to introduce to you Caroline Kant. She's the founder of EspeRare. Like Jos de Blok, she's a social entrepreneur and part of our Ashoka network. She studied and has a degree in molecular biology, design and product development, and worked as the head of the R&D knowledge management department at Merck Serono. But through her own personal experience, she understood that there is something wrong in the way that the pharmaceutical industry and the markets are treating and supporting people with rare diseases. And we're going to see a short video and then delve right deep into the conversation.
EspeRare's mission is to bring hope to children affected by rare diseases. We uncover and we develop treatments to address their unmet medical needs. Developing new treatment is a complex and expensive process. With EspeRare, a model of reviving existing treatments And because we are focusing on rare diseases where there is specific incentives to develop those treatments, we are able to shorten the time, decrease the cost, and increase the chance of success of developing treatments for these patients. EspeRare operates like a non-for-profit biotech. So at EspeRare, we focus on identifying discontinued treatments that have a high therapeutic potential to address rare diseases. We bring our pharma know-how together with philanthropic funding and public funding to revive, develop, and bring these treatments to these patients. It is hand in hand with the patient organizations and the medical experts that we are able to accelerate the development of these treatments. In 6 years, we have proven the validity of our model and show that without the unique model of EspeRare, the treatments that we are developing would have not had a chance to transform the lives of the children affected by rare diseases. Going forward, we want to systematize our impact by developing a digitally enabled platform that will allow all key stakeholders of the drug development process to collaborate. Given the importance of health issues today, we cannot solve them alone. We need partners. We need to create win-win alliance in order to develop impactful and accessible treatments for these children.
Thank you very much. Caroline, I would like to start with you. You've found an ingenious way to shift an ecosystem by unearthing a hidden treasure, in this case, dormant assets in the context of the pharmaceutical industry that really benefit patients. Can you explain a little bit how you've set up this new structure and what the incentives are for the different players and who the players are that you're bringing into this?
Yes. So basically, the players are the usual players, but we are shifting the way the incentive is driven and basically making a difference in the lives of these patients in an ethical way, meaning bringing treatments that are affordable is becoming the big goal rather than to generate profit. And this changes really the way we actually collaborate and build trust into the system. So concretely, after 6 years, what we have done is basically, with my team, bringing our pharma know-how to this non-for-profit model and being able to mobilize philanthropic and public funding. We have been able to develop a portfolio of 6 treatments that have the potential to change the lives of more than 2 million children that are completely underserved by the pharma industry. And last year, what we were able to do is that one of these assets that we matured through this model, we were able to sell it to a commercial partner. And because we are a venture philanthropic model, the returns we are making on this commercial deal are reinvested in our mission and also, and most importantly, shared with our key stakeholders that are the patient community and the academic partners that has shared the risk in terms of developing this therapeutic opportunity that when we picked it up, had no commercial value. And this is really kind of changing the way we generate incentive in terms of the bigger picture with these key stakeholders, because we have the liberty also to drive our decision-making first and foremost in terms of therapeutic potential, healthcare impact, rather than being driven by profit. And that helps also attract talents. Similarly to Joss, our team is a small and agile team, and we work with a big team of recurrent consultants. and how we inspire them to stay on board, because we also need to optimize our costs. Also because we have a responsibility to our funders to make sure that we're not spending too much money. Basically, because we are focused on changing the lives of these patients, this retains our talents.
So explain to me, how did you get those pharmaceutical companies on board? Why would they do that?
Well, basically because we have an analytical way. In every pharma company, you have dormant assets because company change strategies and they start developing a treatment, and then they just deprioritize their asset after millions of investment. And we have developed a unique data analytic approach where we can identify those gold nuggets that can be repositioned in rare diseases. So basically, we come to the pharma company and saying, you are not doing anything with those valuable, potentially very valuable assets for these children, and we can make it a therapeutic success for these children. So we are able to access this IP without paying any upfront. And the deal is that if it's a commercial success, we also share this commercial success through royalty streams with those original asset owner. But really, the model of EspeRare is that in a continuum of different actors, and because it's a very long process to develop a treatment, what we are doing is we are sharing the financial revenues with all key stakeholders, and also really in priority with academia and patient organizations, because they know best how to reinvest money into their research or into driving more health for their patients. We know how to develop drugs, but we don't know how to best reinvest this money for impacting the disease on a bigger scale.
Kevin, I was struck by the fact that you're talking about movement building. That is an unusual term in business context. Let's dive a little bit deeper and understand what you exactly mean by that, and what are the elements of the work that you do that you would describe as movement building, and towards what end?
It's been very important to understand scientifically through third-party, peer-reviewed, validated studies that neurologists and oncologists around the world have been inspired to run. And the data that we are learning from all of them has become a voice for the scientists in the world. The learnings that they're starting to unfold suggests that many of the ways companies make profitability today are actually hurting our health. So the food industry, for instance, has incorporated so many sugars, and the obesity of the United States right now is 70%. And if you're born in the United States today, the life expectancy of the child is lower and shorter than the parent because of this epidemic of obesity around the world due to the food industry creating food addictions through sugars.
So does that mean that you're also bringing the food industry into your conversation?
Similar to what Caroline says, sometimes you have to shame those that might be getting in the way of health. Even the drug industry itself, at times, the fourth leading cause of death in the United States are adverse drug effects. The toxicity of drugs is unbelievable. In the area of cancer alone, chemotherapy kills more than it actually saves. Most of the drug industry is about extending life maybe 6 months to a year, but yet if you could see the cancers very early, you could prevent the progression of the cancers. So we're raising the voice of the scientists that have already discovered these things, and we're starting to shame those through the information that the science is leading. So it's a movement because sometimes, even like the imaging world, there's an epidemic of brain cancer in the United States right now. Joe Biden's son died of brain cancer. John McCain just died of it. My son-in-law is a dentist. Every year they're doing images of your head. There's actually 300 to 400 times more radiation in a brain CAT scan than a chest X-ray. but they're using that for every traumatic brain injury in the United States, 20 million a year. There's so much profitability going into the brain scan, but it's not revealing anything for the neurologist. So we uncover that and we say we could stop brain cancer by stopping the profitability of imaging. So we are uncovering, using the science and increasing the voice of those that are doing the science with a lot of employees that are completely inspired by cancer and by neurodegeneration because it affected their lives, that it becomes so passionate that that information allows the voice of the scientist to begin to change the world.
So I assume you also make enemies.
We make a lot of enemies, but we're always looking for the win-win. And the key here is that we know we can make drugs more effective and less toxic by using biomarkers, and so the pharmaceutical industry is actually leading the charge. So if you looked at the composition of the Powering Precision Health, a lot of it is the pharmaceutical industry. They want to be investing in improving life, and prevention is ultimately something that it's easy for people to see. So I think it's sometimes the science has been blocked by profitability of a very few. So if you can expose that, you can actually create an opportunity for a win-win that everybody wants to be part of it. So it's important to create the positives that are possible as opposed to the negatives that are reactions from it.
Thank you. Jos, you know, a lot of people probably are asking themselves, how do you build an organization without a boss that has 15,000 employees? And, you know, we had a conversation about this also yesterday, you know, and you were saying, you know, just be normal, just be simple. But I think it's a bit harder than that. And I'd love you to explore that a little bit more in depth for all of us in the audience to understand what are the key principles that are driving this massive revolution and that are essentially eliminating things that we thought were necessary, such as controls.
Yes, in the 40 years that I'm working in healthcare, I've seen a real kind of revolution of management ideas. Or perhaps I should not say it's a revolution. But it started in the 90s in healthcare, that more and more it was organized as an industry and industrialized. But before that, I worked in the 80s myself in a more or less self-organized teams. So I've seen the management coming, and I also saw what the effect was of that on the quality, on the satisfaction of nurses. And what I tried to do was, if we go back to build on professional ethics, if you say, okay, a nurse or a doctor, they studied something and they want to do the best possible things, and if you organize it in a way that everybody can oversee what they're doing, then this will be for everybody very normal, and it will grow. That was my idea, and I checked it with a lot of nurses and doctors, and I asked them, do you agree with it, that this is a good way to do it? Then, of course, you had to deal with the system. So the second thing was how can we deal with the system which is focusing on production and products and profitability.
And by system you mean?
The payment system. So the way the system was built in Holland was we had 20 products, nursing care extra, nursing care special, with all different tariffs and different prices, and the organizations were organizing based on the prices and the products. And we said, no, you should organize based on the problems of patients. So, and you should integrate all these products. So we said, we only want to have one service, one product. So give us the average of all the prices, and we will do everything. So that's what we said to the health insurers. So in the health insurers, some agreed, some didn't. Some of them still wanted the lists with all the products, and we said, okay, we built an IT system which gives you the list of the products, so then you are happy, but we are doing other things. So, but they didn't mind. So, and then we started to talk with the ministry. They said, if you change the pattern of thinking in community healthcare, it can save you a lot of money. So, and all these things together were part of my idea of a transition which was needed to change the perception of community healthcare. So So one, the organization, and also dealing with the system and dealing with the stakeholders was a very, a very circular process, all the time being aware that, like my neighbor said, you had enemies everywhere, because it was in contradiction with the existing system.
I can imagine.
So, but I learned from, for example, Peter Drucker, and from a lot of people who had very good management ideas, that by creating a conscious way of looking at management, that you can integrate management in the daily practice of everybody. So we separated the management structure from the primary process, and in my opinion, you should look at what ways do you see to integrate different roles and activities in one person. HR activities the same. You can integrate HR activities in the daily practice. People can hire their own colleagues. They can evaluate each other. The same with the financial part. So when you keep it simple, as I said, everybody can take responsibility for the financial part. So my idea is to build an integrated system based on the philosophy that every person is a good person and wants to do good things. But this trust, that's in the mindset of management, it's a very difficult thing. So a lot of people think people need to be controlled, otherwise they are lazy and not going to do what they should do. And I think you should choose for an opposite mindset.
One of the themes that I'm seeing emerging from the cases that you presented is the question of responsibility and empowerment, right? So in a way, when we think about society today, we have these fixed roles, right? A doctor is there for me to become healthy. So the question of my personal responsibility for my own health, is kind of put into question. The same, applies to Caroline's model, where you are really, co-driving the evolvement of new treatments with patient organizations. And I'd love to hear a little bit more about how you are using, I would say, this unlikely actor in the drug development process, and how you're leveraging the wealth of information that people who are personally affected have.
Okay. So the domain of rare disease is somehow a pioneer domain where patients had no choice than to educate themselves and get engaged into taking care of their own health, because basically there's not enough medical doctors that knows about how to treat them or their child. So basically, historically, these patients had no choice than to organize themselves virtually, to start understanding the science, educate themselves. And this is really also shifting, and rare disease is being pioneer in shifting how patients are being a success driver in the way we develop treatments, but treatments that not only are targeting what we understand as a clinically relevant outcome for doctors, but targeting treatments that will really make a difference in the lives of patients at different levels in terms of their ability to have a social life and other factors that are encompassed in what we understand by healthcare. So, because by listening to their voice, well, you don't choose necessarily to develop and prioritize the same type of treatments.
So how do you prioritize then which treatments you are going for at EspeRare?
Okay.
What is your decision-making matrix there?
Yeah, so one of the prioritization metrics is that because we are mobilizing philanthropic and public funding, we are only going for diseases where there's a complete unmet medical need and where we can really truly transform the lives of patients. So we have identified a subset of rare diseases where we know we can make a life-changing or life-saving impact. The other aspect in rare diseases is that there's more than 7,000 of them, and unfortunately, a certain amount, we don't even understand enough of the science to even ambition to go into developing a treatment. So we also had to prioritize in terms, is there the right infrastructure to even ambition to develop a treatment? And so what is for us the most important is having the drug development infrastructure in terms of clinical outcomes to show efficacy, but first and foremost, are they patient organization organized enough and also savvy enough to become a partner for us in the drug development process? And basically, to strengthen this key partnership, what we have developed and pioneered is a legal framework with the patient organizations where, for us, what is the most important is to set expectations from the start of what they can expect from us as drug developers, because obviously there is regulations where, for example, as drug developers, we cannot go and talk to families directly. We can talk to patient representatives, but we cannot do certain things. So we have to manage expectation from the community of what we can do. But in this legal framework, we also have set what we expect from them, meaning that they inform our research at each step of the way, and also that we invite them to the table in terms of key interface with stakeholders like regulators, payers, etc., because this is also changing the culture shift of what is an impactful treatment. It's not only about medical outcome, it's about how it changed their lives in a broader sense.
Kevin, you, when we had our conversation to prepare this, you were talking about, and you mentioned this briefly, about sort of fairness as sort of the elephant in the room, sort of a big company that defrauded its investors by making claims and raising expectations. Can you talk a little bit about how leadership has changed for you, given this sort of tension of wanting to drive a movement, but also being confronted with someone that has really badly led down people?
It's a very delicate walk because, in the end, trust is at the basis of every ecosystem, and how we create win-win relationships across pharmaceutical companies, across investor base, the different patient organizations. It's a very delicate walk of trying to find the win-win. And what we were able to do is to spend 3 years working with all the neurologists and oncologists to run their own studies to create what we call scientific validation through third-party peer-reviewed publications. We invested 3 years of the movement, Empowering Precision Health, to inspire all those neurologists and oncologists, because we felt those were the two disease categories where today life is being hurt the most by seeing symptoms and the disease very late stage. And so by seeing non-invasively in blood, almost like seeing a grain of sand in 2,000 Olympic-sized swimming pools, we've been able to create a technology that's true and has a lot of scientific validation. So the win-win for investors is if you can apply these learnings and you can see and be part of the actual movement, where at Barcelona this week, we actually had some of the top investors in the world sitting with all the top oncologists and neurologists with the patient organizations all in the same room. And when they each tell their stories, it creates a higher purpose inspiration that allows the investor then to see that if we make major investments into this technology, even if there's not profitability for the short term, it's going to create a lot of R&D investment that could lead to a revolutionary change in the way healthcare is practiced. France and Japan right now are living 8 years longer than the rest of the world, and they're doing it for like 1/3 the expenditure because they've eliminated sugar. They've eliminated a lot of the things that the science now is beginning to reveal. And so it's easy for investors to start to see there's a longer term opportunity here to change healthcare and prevent a lot of pain and suffering and cancer and neurodegeneration. And when we get people to stand up like Nancy Frates, Pete Frates was the inventor of the Ice Bucket Challenge. He's been on a ventilator for 5 years. He has ALS. his mother came and gave a passionate plea that we need to go after ALS and these biomarkers. He's raised nearly $1 billion with the Ice Bucket Challenge. So we had the top pharmaceutical companies in the room. She gave her passionate speech. The investors were in the room as well. Since then, there's been 2 biomarkers for ALS discovered by Mayo Clinic, and we're now using the biomarkers to try to come up with new drugs to fight ALS. So that's an example where if you get the right people in the room and they can tell their stories in a productive setting, you can move the needle for inspiration and create a win-win, even for investors who just literally 2 years ago were defrauded. They are completely behind us because they see we're going after something with scientific validation that's inspiring a change that will help everyone in the world.
Jos, one of the themes that always comes up for me when I think about your model is the question of power, right? Because you've been very intentionally, shifting power to your nurses and away from management, from leaders, from people in hierarchies and bureaucracies. But, the more successful you are, and we were talking about one of the clauses in your contract with one of the insurance companies yesterday that said, in case we have a disagreement, we'll open a bottle of wine. That to me is an indication that you've shifted power to your side, right? So let's explore a little bit this question of power dynamics, not only within your own organization, but for you, as somebody who now has 80% market share. You're almost a monopoly.
No, it's in total, it's 20%.
Okay. I'm exaggerating.
That doesn't matter. A lot of other organizations are now also experimenting with the same concept. Now, I think when you talk about power, the power should be with the patient, I think. So the idea is that what I learned as a nurse is that it's a very delicate process to not to put power on the patient. So patients are depending on doctors and nurses, and in a lot of vulnerable situations, it's easy to decide for them. So what I wanted to achieve is that in the daily processes, the patient has control on their own lives. So if too many people are dealing with patients, they lose control. So continuity is a very important thing, and then to be able to make the decision as a nurse or as a doctor, you have to have the autonomy to do it. So if somebody else is telling you what to do, then it has a big impact on your daily work. So for me, always the perspective of the patients is leading my actions. And I think if you look in how we are dealing with rules and regulations in the system, we made it very complicated. It's a very legal perspective usually, and we try to translate it to a more patient-related perspective. So we say, let's use normal language in a contract. So the example you mentioned with the health insurance said, let's sit together on the table and let's define together what is good healthcare. What are the good interventions for people with dementia or people who are chronic diseases, and let's write it down and let's say, okay, if we want this, what does it mean for the financial side? And we changed the contracts, conscious contracts we made, we changed it from 100 pages to 6 pages. And we said in one of the contracts, we should not argue, we should have a dialogue when we don't agree. So let's have a good glass of wine and talk about it. And that became part of the contract. So 4 years ago, we were still sitting at the table as more or less as a kind of enemy. And now we are sitting around the table as friends. And it leads to another way of talking.
But how did you do that, right? I mean, it sounds so easy, but getting a contract from 100 pages to 6 pages, is it trust? Is it confidence in the quality of your work? Is it the outcomes and results that they see that allows them to reduce the amount of control that they need on their side?
I think it's a combination of all these things, but I think most important thing is that I am privileged that I am a nurse. So I see I'm healing the system, so I use my nursing skills in the dialogues I have with everybody. So I said, the system is ill, so we have to find ways to cope with it, and this is the way I talk with all the stakeholders. So they're part of a system, and if we can change it to a more healthy system, and we use more the professional skills from doctors and nurses also in healing the system, I think we have a good future.
So it's actually the people that are affected by something that should be starting the companies and the organizations that are fixing the problems? Is that an insight that you think?
Yeah, so I think if the management should also combine their management work with also being a doctor or a nurse, I think it would improve the quality of a lot of things. Thank you.
Kevin, what is one learning from your sort of experience in building this movement, in shifting mindsets, because that's really what you're doing, right? That you would want to share with our audience before we close?
I would say that transparency is a very powerful term that a lot of folks don't really truly understand the potential that transparency can create. The term for me is, how do you bring exposure to situations in a productive way? And I would say the concept of culture that's rooted in trust, how do you accelerate the speed of trust? Everything I'm listening to by these, Caroline and Jos are incredible what they're doing, but they're accelerating the trust. I mean, I just look at what they say and I trust them. And I think in the end, how we accelerate trust in every setting, whether it be in our companies with all the employees and what they're doing, or in the bigger ecosystem where you have investors, you have the pharmaceutical companies, you have the scientists, you have the patient advocacy groups. How can you work so genuinely? As a nurse, he's very believable because they know he loves. He gives more than he takes. And so once people understand that they're dealing with someone that truly is trying to do something good for the world, I think what you end up with is an opportunity to accelerate trust. And if that person has also got the capability to move the world and take their trust and apply it, they can actually continue to build trust as opposed to having to use the trust that they're building. I actually think if you take the right steps, the frontline people know what's really going on in any organization, and it starts with them. It's the secretaries, it's the people, the verbs of the business. If you can open up their voice and you can connect to them, the trust gets inspired, and there's nothing that can stop that force. And if it's going to be good for the world, it's going to be something that everyone will get behind, but you have to use the trust to build more trust and to accelerate it. And I think there's an opportunity with great minds, if they just apply those, being willing to address the elephant in the room with transparency. In this case, the whistleblower for Theranos, we put him on the stage with us over in Barcelona. That's George Shultz's grandson who had the courage to blow the whistle. So instead of denying this, we put him on the stage and we said, let's talk through. And everyone in the room was clapping as we were talking about how we're applying that to accelerate the trust of our ecosystem. So take the elephant in the room, go after it, don't deny it, and I think you'll build trust in an organization, and then you'll end up winning more in the end by doing so.
Caroline, what's your next big thing?
Well, my next big thing is sometimes with innovative model, because let's face it, we are the first to have dared to be a non-for-profit biotech. Well, we are actually pioneering to be able to correct genetic disease before birth. So, I mean, this is also in some ways prevention, because some genetic disease, when these kids are born, it's too late. They already have permanent damages. And what we have been able to do is that we have been able to actually inherit a treatment for a rare disease affecting the development of glands in the body, where originally commercial investors had decided to actually position this drug in treating after birth. But unfortunately, the window of opportunity of actually reverting this genetic defect is before birth. And the story is always about patients, because basically this treatment didn't show efficacy, but in the meantime, there was a mother, and you've seen these two kids on the video. She had already an affected boy at home that could not sweat, that overheated, and she was expecting these two twins also affected by the genetic disease. And she begged a very brave German doctor to actually inject the treatment in utero. And he did. And these twins and another baby were treated in this way, and they were born, and their genetic defect was actually reverted. And with this data, with this therapeutic impact, original investors didn't want to take the risk to go in a completely new area of medicine, meaning using therapy to correct genetic disease before birth. So they approached EspeRare and said, if you're able to redevelop this treatment in this in utero setting, we will transfer the full assets. And well, we had discussions with regulators because it was never done before. We raised philanthropic money to create a new team and expertise around the project. We got the support of the regulators to say, we are convinced about the efficacy based on these 3 anecdotal cases of the treatment in utero. So if you're able to confirm in a pivotal trial, meaning a trial going for the market, on 20 other patients treated that way, we will let you bring this treatment to the patients. And so this is where we are now pioneering treating, also in some ways preventing genetic disease. And what we want to do to stay in this collaborative spirit is that currently we are setting up a pre-competitive center of excellence around this prenatal medicine, because most experts are now into the academic world, and they have been exposed to the pharma reality of what it means to bring this treatment to the market. So we feel it's very important to first develop a pre-competitive platform so that we can build together the knowledge and also identify these opportunities for this new area in medicine.
I have no doubt that you will be successful. Thank you all very much for this panel.
Great job, Caroline. Keep it up.